Imagine being in a state where you are partly awake and partly asleep, performing actions without conscious awareness or control. These events are often accompanied by reduced responsiveness to external stimuli, mental confusion, and a frequent inability to recall the event afterwards. The challenges posed by these disorders are significant. For individuals, these episodes can be distressing, potentially leading to self-injury or injury to others. Untreated adult sleepwalking, for instance, can induce violent behaviors and self-injury or injury to bed partners. Beyond the immediate risks, these disorders can lead to sleep disruption, excessive daytime sleepiness, fatigue, and psychological distress, all of which significantly affect health-related quality of life. This can lead to a sense of embarrassment or stigma, impacting social and professional lives. While often considered harmless and transitory in children, these disorders can persist into adulthood or even appear for the first time in adult life, presenting unique challenges. NREM sleep arousal disorders encompass three primary clinical entities, all of which are behavioral manifestations of incomplete awakenings from sleep. Confusional arousals. These are episodes of incomplete awakening from sleep, where the individual appears confused, disoriented, and responds slowly or inappropriately. They might sit up, mumble, or appear bewildered. Sleepwalking. This involves complex motor behaviors during sleep, ranging from sitting up in bed to walking, eating, or even leaving the house. The person's eyes may be open and appear glazed over, and they are typically unresponsive to attempts at communication. These events arise primarily, but not exclusively, during NREM stage 3 and 3 sleep, which is the deepest stage of non-REM sleep. Common triggers for these episodes include sleep deprivation, emotional stress, fever, certain medications, and alcohol consumption. The underlying pathophysiology is believed to involve a dissociation between sleep states, where parts of the brain are awake enough to perform complex actions, while other parts remain in deep sleep. The excellent news is that effective strategies, particularly natural and behavioral interventions, can significantly reduce the frequency and severity of NREM sleep arousal disorders, making recovery possible. The first key step is seeking a professional diagnosis from a sleep specialist to rule out other conditions. For managing NREM parasomnias, non-pharmacological interventions are often effective. These natural treatments primarily focus on optimizing sleep and creating a safe environment. Improving sleep hygiene, this is foundational. Establishing a consistent sleep schedule by going to bed and waking up at the same time every day, even on weekends, helps regulate your sleep-wake cycle. Ensuring your sleep environment is dark, quiet, and cool can also promote deeper, more stable sleep. Avoid stimulants like caffeine and alcohol, especially in the evening, as they can disrupt sleep architecture. Stress reduction techniques. Since stress and anxiety can be significant triggers, incorporating relaxation techniques such as mindfulness, meditation, or yoga into your daily routine can be beneficial. Cognitive behavioral therapy and mindfulness-based stress reduction have shown promise as non-pharmacological treatments. Melatonin supplementation. Some research suggests that melatonin may be a promising treatment for NREM parasomnias. However, always consult a healthcare professional before starting any supplements. We've explored non-rapid eye movement sleep arousal disorders, understanding their perplexing nature and the challenges they present. The good news is that through behavioral strategies, sleep hygiene, and safety measures, significant improvement is often within reach.